First, we will start with a brief introduction explaining what ambulance imaging is. It is the use of medical imaging technology such as CT scanners in ambulance vehicles. Ambulance imaging provides portable and fast diagnosis while also aiding in the immediate treatment of patients. A specific example of ambulance imaging is Australia's first mobile stroke unit, or the MSU for short. A CT scanner can produce detailed images of the internals of the human body, and in the MSU, a portable scanner is used to diagnose a stroke patient by scanning the brain. It can also help determine the type of stroke the patient has experienced in order to ensure correct treatment is administered. Basically, a CT scanner works by taking many images of a cross-section of the body to produce an internal image. A stroke is when blood supply to the brain is interrupted, resulting in a lack of oxygen reaching the brain. There's two types of strokes. Ischemic strokes are the most common and are caused by a blockage in a blood vessel, usually by a blood clot. Hemorrhagic strokes are usually caused by a burst blood vessel causing bleeding on the brain. A stroke causes cells in the brain to die. This can happen in as little as 3 to 4 minutes. Specific bodily functions are affected by cell death in certain parts of the brain. An example of this is a stroke in the parietal lobe. It is responsible for processing sensory information, and when affected can cause vision problems and numbness, among other things.
Why would ambulance imaging be so important? If you think about it, cells are being affected soon after a blood vessel in the brain bursts or is blocked. This indicates that immediate medical attention and treatment is needed. So which do you think would be a better option? A stroke patient being taken to the hospital in an ordinary ambulance vehicle, or being driven to the hospital in a mobile stroke unit? In this case, the mobile stroke unit would be the better option. This is because it provides services that will help diagnose stroke at a faster rate on the way to the hospital. It is through ambulance imaging that the affected site is located, and hence the type and nature of stroke can be determined, allowing for immediate treatment to commence. This strategy decreases the severity of the effects stroke have on patients. Hence, this is what makes ambulance imaging so important, its time efficiency. But why are these services made for the treatment of stroke specifically? As seen in the graph, in 2016, stroke had been the second most common cause of death, with around 6 million people being affected worldwide. Thus, with the innovation of ambulance imaging, the prevalence of death caused by stroke can be reduced.
Challenges of mobile stroke unit. The first main challenge is the cost. It is an expensive technology as it includes the cost of vehicle, equipment, maintenance, and staff. Second is availability and capability, mostly in rural areas, unavailability of equipment and trained staff which make it less capable of treating stroke patients. Third is design and installation. Imaging modalities are bigger in size, hence physicians have to carry out multiple tasks within confined space. Also, generator needs to be installed to generate electricity, as CT scanner needs high voltage of electricity in order to operate. Next is communication disruption and reliability of data, which may be caused by an operator error or poor network connections, making it difficult to transfer data securely from one point to another. Then is limit to clinical decisions. In the absence of on-board physician, it is difficult to make certain clinical decisions, for example, whether to administer thrombolysis, which require clinical judgment. Next is radiation exposure. Radiation shielding of CT scanner needs to be assessed before putting the mobile stroke unit into service. Transportation issues. The scanner should be stable and secure during the transit. Implementing proper transport channel will also overcome congestion problems of traffic.
Ambulance imaging has been shown to have many benefits, some of which include the following. Number 1, it reduces the time taken for treatment to start. Time is a critical determining factor in the outcome of a stroke patient. As opposed to a regular ambulance, the brain scans produced by the CT scanner in the stroke unit allow for the immediate diagnosis of stroke. The images of the brain help make an instant distinction between the two main causes of stroke, either a blocked blood vessel supplying blood to the brain or a burst in a blood vessel near the brain. Once the type of stroke is identified, immediate treatment can start in the ambulance. Studies have shown that the use of ambulance imaging has approximately half the time taken for treatment to start. The second major benefit of this service is the reduced length of rehabilitation after treatment. The outcome of non-fatal stroke can vary greatly, from paralysis to loss of certain everyday skills. Starting treatment faster could result in reduced brain damage, and therefore the rehabilitation required for recovery is also significantly changed. Hence, both financially and emotionally, the treatment and post-care of stroke patients are in favor of ambulance imaging. The addition of ambulance imaging in conjunction to regular ambulance services will allow for further research into the prevention and treatment of strokes. The collected data will create a new foundation for stroke research and the possible innovation of ambulance imaging for other life-threatening conditions.
Future prospects of mobile stroke units. The first is cost effectiveness, which can be improved by replacing onboard physician with telemedicine remote expert. Next is reliable telecommunication. Moving from 3G to 4G and to 5G in future, we will have better connectivity and speed and more reliable bidirectional telecommunication. Air mobile stroke unit will benefit remote locations by reducing the distance and travel time to stroke center. Innovative technology may allow for smaller and more robust unit CT scanners. And MSU concept can be expanded to treat other medical emergency conditions in underserved areas.